Hey, it's Mo Egger. You've heard me talk about Long Neck Sports Grill for a while. There's no better place to hang out during the summertime than the Long Neck's patio. They've got Northern Kentucky's best wings, an awesome beer selection, 4K TVs. It's a great place. But have you ever thought how cool it would be to have a Long Neck's in your neighborhood? Well, your chance is here. Check out the franchise opportunities by going to longnecksportsgrillfranchise.com. That's longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long. Come often. We do this on Wednesdays. We chat with one of the experts from OrthoCincy. Great thing about OrthoCincy is they have specialists and locations across the tri-state offering walk-in orthopedic urgent care weekdays 9 a to 9 p, Saturdays 9 a to 1 p. Learn more. At orthocincy.com. That's orthocincy.com. Dr. Angel Velazquez is with us. Bengals made it official. Cam Sample is going on the injured list with a torn Achilles. We've obviously talked about these types of injuries before, but remind us what the Achilles tendon is and what it does.
Well, thank you for having me today, Mo. First, the Achilles tendon is the continuation of your calf muscle. So your calf muscle contracts to pull the Achilles tendon that pull to the heel and make your foot going down. So every time you are going to push off from the ground, you contract that calf muscle or gastrocnemius that pull the Achilles tendon. So, this is an injury that is really common on sports who require a lot of running, jumping, especially stop and going. So basketball, tennis, football, soccer, those are sports that require a lot of those movement, abruptly movement. Obviously in baseball happens too, but it's less likely than all those other sports.
As a sports medicine professional, when something like this happens, do you have a pretty good idea almost instantly that the Achilles is torn or that it's at least an Achilles injury?
Well, if you're watching, obviously, this game, when you're on the sport, if you're on the sideline, so you're watching from there and you're watching the play, you could see when the mechanism of injury happens, when the person is pushing off, how they just stop and grab their ankle. So just by that, you're like, okay, he's pushed off, grab the ankle. Yeah, this could be an Achilles tendon injury. But of course, when you get there to the athlete, they're gonna tell you, hey, I felt a pop, and you can definitely feel the divot or the separation of the tendon. And obviously, when you contract or when you compress the calf muscle, you don't see that foot going down or plantar flexion. So I for sure, at least when you put your hands on the athlete.
The belief is that Cam is going to be okay to play in 2025 and be on the field for summer workouts next year. So walk me through the timeline from last week when he suffered the injury almost a week ago to the surgeon's table, assuming there's going to be some sort of procedure, and then what the rehab and recovery look like.
Well, number one, what is the average of how many people are on risk for having this Achilles tendon rupture? Males over females, and obviously the sports that I already mentioned earlier. There's a study several years ago that looked at 13 different articles about professional athletes or elite athletes who have Achilles tendon rupture, and they look at 709 of those athletes in Major League Baseball, NBA, professional soccer, NFL, and they figure out that around 80%, 61 to 100% actually were returned to full activities after the injury. And if you look, these are big range. 61 to 100% is a 40% difference there. So number one, when the athlete had this injury, they have to go to the process of diagnosis that could be on physical exam with ultrasound and MRI. Then obviously the news are delivered that the athlete has an Achilles tendon rupture. When that inflammation from the Achilles tendon rupture go away, relatively soon they will get the procedure. Traditionally, they have a long incision that go through the skin to expose that Achilles tendon. And now we have this relatively new procedure that everybody knows about, Aaron Rodgers, that is the speed bridge, where the incision is smaller, is side to side instead of long. And actually the suturing doesn't go directly to the defect or the tears, go from the good tissue of the tendon on one side to the good tissue on the tendon on the other side, and there's some anchors on the heel. So that allow the tendons to have less tension while they're recovering, and obviously that allows for a quicker and more aggressive rehab program. Time frame, typically about 6 months, people start doing some sport-specific activities. With this procedure, we're talking about 4 months. So that's a big difference there, 2 months. Then that's why you could see Aaron Rodgers doing things in the field, really early.
Yeah, no, he obviously flirted with coming back last season. Dr. Angel Velazquez from OrthoCincy is with us. Let's talk about Matt McLain, who we have talked about a ton. He has not played this year. They've been targeting a rehab assignment starting on Monday. However, he's had a recent complication with a stress reaction in his rib cage. Now, all the reporting from GABP would suggest nobody thinks this is going to be that big of a deal. They're still targeting August 12th. I hate to do this, but when it comes to Matt McLain, I've developed a great amount of skepticism. Let's talk about this newest development, a stress reaction. What is the cause? What is it? How does a stress reaction occur in the rib cage?
The rib cage has a bunch of muscles that are over the area. You have the muscle that make you or help you to take a deep breath, the one that help you to take the breath out, and then you have the oblique muscle that you rotate. So any of those muscles that you are activating by, in this case, recovery, trying to come back, trying to speed up, can pull a lot of stress into the rib cage, causing that the rib cage or the bone get bruised, and that's a stress reaction. It is not a significant injury. It's just about, giving it time with pain control and be sure the pain goes away before you're active. It's really common on swimmers, actually, but obviously you have a guy that is coming from a shoulder injury, things you need to learn again how to do some motion and probably trying to speed it up, to trying to come back relatively quick, especially hitting. Probably that's where he got it. Other thing that I look at my patient is vitamin D deficiency. It's controversy, but we see vitamin D deficiency that actually increase the risk for stress fracture. So that's one of the things that I would look for. But it's about pain control. It's about giving it 2 to 3 weeks to get that inflammation goes down in the bone and then speed it up and go from there.
Awesome insight, as always. You are the best. We'll talk soon, man. Thanks so much.
Thank you, Mo. Thank you.
Much appreciated. Dr. Angel Velazquez from OrthoCincy. We say this every week. The great thing about the people at OrthoCincy is they have specialists and locations across the tri-state, which includes walk-in orthopedic urgent care weekdays 9 a.m. to 9 p.m. and on Saturdays 9 a.m. to 1 p.m. in Edgewood and Anderson. It is easier and cheaper than going to an ER when you have an urgent orthopedic injury. Just go to OrthoCincy.com. That's OrthoCincy.com. Hey, it's Mo Egger. You've heard me talk about Long Neck Sports Grill for a while. There's no better place to hang out during the summertime than the Long Neck's patio. They've got Northern Kentucky's best wings, an awesome beer selection, 4K TVs. It's a great place. But have you ever thought how cool it would be to have a Long Necks in your neighborhood? Well, your chance is here. Check out the franchise opportunities by going to longnecksportsgrillfranchise.com. That's longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long. Come often.